Welcome to our educational video. The topic we are going to cover is seizure testing. One of my main goals is to send the message that the testing that the nurses do when they are in there at the bedside is really important for best patient care on our epilepsy monitoring unit. Let's start with the most critical piece, and that is patient safety. When a patient has a seizure, the nurses go in and they make sure the patient is not injured. As we know, patients can fall with their seizures, land on their face, get a lot of injuries. So really critical that nurses are there to help the patient. Other issues to consider, things like respiratory problems, aspiration, cardiac arrhythmias. There are several serious medical issues that can come up with seizures, and nurses need to be there to help the patient. Our nurses do a great job with that, and we need to kind of keep that up. In addition to patient safety issues, we really want to have the nurses in there doing testing both during the seizure as well as in that postictal state. We get a lot of very critical information when nurses do that testing. For example, during the seizure, if nursing testing can let us know if the patient is confused, that helps us figure out what type of seizure the patient's having. Is it a simple partial seizure where the patient's completely aware, or is it a complex partial seizure where the patient may be confused? That may have implications for whether the patient is safe to drive or other important issues. The other factor is if a patient is very confused and the EEG is completely normal, that would suggest that the patient's having a psychogenic non-epileptic event. So critical information for diagnosing the seizure type. The other issue is whether the patient can talk. If a patient can talk and they're having a temporal lobe seizure, that would support a right temporal lobe seizure because the language is not affected. So it helps us localize where the seizure is coming from. In addition to doing testing during the seizure, testing in the postictal state is also critical. For example, you test the patient for that memory word. During the seizure, nursing staff has provided a memory statement, memory item, and whether the patient can remember that helps us know whether they were amnestic during the seizure. That can help us decide, again, how intense the seizure was. Was the patient confused? Also helps us know if it's a non-epileptic event. If a patient's completely amnestic during the seizure and their EEG is normal, again, helps us clarify whether that's a non-epileptic event or not. So all this is very valuable. Another piece of information in the postictal state is how long does it take for the patient to get the ability to read that sentence. So the nurses will do testing with that sentence during the seizure as well as in the postictal state, and patients will have aphasia, which you can demonstrate by showing that having them read that card. And if they can read the card quickly after the seizure, that suggests that there was no aphasia. But if it takes longer than a minute for the patient to be able to read that sentence, that would suggest that the language area is engaged with the seizure, so often is associated with left temporal or left side of the brain seizure activity. So again, very important information for localizing where the seizure is coming from. So this information, critical that the nurses will document this information. So nursing staff can put this information ideally use the nurse template, nursing seizure template, so they can document what time the seizure occurred, what were the characteristics of the seizures, was it a typical seizure? These are all important pieces of information. Document auras. Auras are really helpful to clarify because patients often don't know exactly when their auras occur, but if the nurses will document it, it can be very, very helpful. A lot of times, patient may have a deja vu aura or a nauseate aura, and sometimes we can get this nice buzz of seizure activity with that aura. So very valuable information. So in summary, if nursing staff does really outstanding testing with the seizures, then the patient is kept safe. We can get information about where the seizures are coming from and what type of seizure the patient is having, and clarify if it's an epileptic seizure or a non-epileptic event. So really important information. So thank you for watching this video.